What studies say about Fenugreek? The first largest study was again a double-blind randomized clinical trial in 2016, which was based in Australia, and they took 120 men. So this is the largest study. 60 men were in the control group, and 60 men were in the intervention group and received the fenugreek seed extract called Tesfen. Now, these guys at baseline were overweight and obese. They were an average age of 54, and their average body mass index was 30. And when you design these studies, you have to look at the primary outcome. So the primary outcome of this study was particularly looking at the symptoms of androgen deficiency. And they measured this by looking at a validated questionnaire called the Aging Male Symptoms. They wanted to see, do your symptoms get better taking this medication or this supplement? They also looked at other secondary outcomes like sexual function, sex hormone concentrations, and even sleep quality. So in terms of deficiency symptoms, they did find a significant difference between groups. So in the entire score, which was like overall score as well as subcores of sexual subcores as well as somatic subcores. Now, what is a somatic subcore? It looks at 4 questions specifically looking at general well-being, muscle aches, and sleep quality, as well as excessive sweating. And so in those groups, they saw again, overall, they saw an improvement. They also saw a difference in sexual function using another questionnaire in terms specifically of sexual arousal and sex drive. They also noticed that in terms of erections, they had an average of 1 erection per week prior to this study, and then after they were supplemented, they noticed they were having about 2 to 3 erections per week. In terms of hormones, they saw a small but what they call significant increase in testosterone, specifically total testosterone values from the baseline to the 12th week, which was going from 12.3 nanomles per liter to 13.8 nanomles per liter. And they also noticed an increase in that calculated free testosterone from 241 picals per liter to 264 pom per liter. Now, they did not see any significant side effects with the supplementation. However, less than 5% did have headaches associated with taking the sub. So bottom line, they saw that it was safe and effective, at least reducing symptoms and improving sexual function. And they saw this slight increase in testosterone.